Bore da I pawb, welcome to you all. It's a delight to be opening this third Rural Health and Care Conference here in Wales. This year's event takes place in changing and challenging times for rural Wales. Brexit has turned our politics upside down and is causing great uncertainty for people, businesses and communities living in rural Wales. Climate change is obliging us all in urban and rural areas to look carefully at our carbon footprint and to make changes to the way that we live and work in the future. And new technology, automation and AI is forcing us to think in new and creative ways about the future of agriculture and rural communities. As First Minister, I'm acutely conscious of the pressures and the stresses that those things place on the health and the well-being of rural towns and villages. As a Welsh Government, we don't have all the answers to those questions, but we do have the commitment to walk alongside rural communities as they face change and uncertainty. As many of you will be aware, I was born and spent a considerable part of my young life living in rural Carmarthenshire, so I feel a personal connection to those rural communities. I know that living in a rural area poses different challenges and offers different opportunities to those living in our more populated urban areas. And so it means different challenges for those providing services and healthcare in rural areas too. Now, in that context and faced with those challenges, today's conference to discuss the future of health and care in rural Wales is genuinely important. Because whatever the future holds, we want our rural communities in Wales to be strong, resilient and crucially healthy places. Places where it is attractive to live, work and raise a family. That's why I welcome the new recent report by Public Health Wales and the Mental Health Foundation, highlighting the impacts Brexit could have on the mental health and well-being of farming communities. Their report, exploring the pressures, burdens and isolation felt by many rural farmers, is something I want to look at and examine really carefully, particularly the issue of mental health. As a Welsh Government, we have committed to working with partners in rural areas to support better mental health services. We've provided funding to deliver free mental health first aid training to vets and develop better signposts for farmers and others in need of crisis advice and support. But there are important ways in which that support needs to improve over the coming months and years, and this conference will be important in helping us all to shape that work. On climate change too, your ideas and thinking will be critical to help us take the next steps in cutting our carbon emissions. Our National Assembly recently was the first parliament in the world to declare a climate emergency. And we did this because of the huge impact that we know that climate change will have here in Wales in the years ahead. Indeed, we are already seeing the impact of extreme weather and flooding in many of our rural areas. Responding to the challenges of the climate emergency is a responsibility and a duty all of us share and will require difficult decisions about how we adapt and innovate. But change we must. From Brexit to mental health to economic development, rural Wales faces a number of major challenges over the coming years. Challenges for which there aren't any ready or easy answers. But in the Welsh Government, you have a partner ready to work with you. Ready to work together to build a brighter and healthier future for Wales, fit for those future generations. I hope you will have a great conference working on these crucially important agendas.